This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together. This video will be presented in 7 sections. Section 1, Introduction. Section 2, How to get started. Section 3, Hand hygiene. Section 4, Prepare a clean workspace. Section 5, Gather supplies. Section 6, Draw medications from a vial. Section 7, Draw medications from an ampule. It is now time to draw up a medication from your medication vial or ampule. We will review how to draw up medications, both from a vial and an ampule. You may need this medication to add to an infusion bag or to inject into the body. Your doctors have provided orders about what to do with the medication after you draw the medication up. Other resources will tell you what to do with the medication after you draw it up. Please watch this video as many times as you need. If you have a caregiver or family member assisting you, please have them watch this as well. Section 2, How to get started. Your nurse will tell you at approximately what time you should be ready to draw up your medication. Sometimes medications that patients need to draw up come in a vial. Vials have a flat bottom and a flat top that is covered by a cap. Sometimes medications that patients need to draw up come in an ampule. Ampules have a flat bottom, narrow towards the top like a collar, and then form a point like a hat at the top. To get to the medication in the ampule, you need to snap off the top. Always check your orders or patient information form against the prescription on the ampule or vial. Make sure the medication in the vial or ampule is the right medication. Make sure the dose matches. Make sure it has your name on it. Make sure the medication has not expired. Make sure there are no particles in the solution. If there are any errors or particles in the solution, or the medication has expired, call your nurse. Now, let's talk about the most important step, hand hygiene. Practice good hand washing. Washing your hands helps reduce your chance of infection. Use soap and water at first. Make it a habit to wet your hands. Apply soap until lathered, and then scrub your hands for at least 20 seconds. To make sure you are taking 20 seconds, sing the Happy Birthday song twice. Then dry with a clean paper towel. You can use hand sanitizer after you've already washed your hands with soap and water. If you use hand sanitizer provided by your healthcare team, rub a nickel-sized amount between all parts of your hands using friction for at least 20 seconds until they are dry. Never wave or blow on your hands to speed up drying. Even if you are using gloves, you must still wash your hands. If your nurse tells you to use gloves, put your gloves on after washing your hands. Section 4. It is important to find and prepare a clean, dry, hard work surface to set up your supplies. Clean the workspace with a gentle cleaning solution, such as a disinfectant spray or alcohol. Use a clean paper towel. Wash your hands as you did before. If you are wearing gloves, remove the gloves, wash your hands, and put on new gloves. Section 5, Gather supplies. The next step will be to gather your supplies. Your home infusion agency should provide these supplies. If you are missing any supplies, please call your home infusion agency. You will need alcohol pads to clean the top of the vial or ampule and the tip of the port. If you have a vial, you will need 2 alcohol pads. If you have an ampule, you will need 3 alcohol pads. 1 syringe. If you have a vial, you will need 1 regular needle. If you have an ampule, you will need 1 regular non-filter needle and 1 additional needle with a filter. Your medication vial or ampule, and 1 sharps container. Wash your hands as you did before. Section 6. Draw medications from a vial. We will first talk about drawing medications from a vial. If you use a vial, first flip the cap off of the medication vial. Scrub the top of the vial with the alcohol pad for 15 seconds. Take the syringe out of the package. Hold the syringe in your non-dominant hand. Twist the needle clockwise onto the syringe to hold it in place. Take the cover off the syringe needle. Do not touch the needle or syringe tip. If you do, or if it touches a surface, throw the syringe away and use a new one. Pull back on the plunger of the syringe to draw enough air in the syringe equal to the amount of medication you are told to draw from the vial. Push the needle through the center of the vial. Push on the syringe to put air into the vial. Turn the vial upside down. Point the needle towards the bottom of the vial. Pull back on the plunger to remove the ordered amount of medication. Pull the syringe out of the vial. Now you need to remove air from the syringe. Hold the syringe with the needle pointing straight up. Tap gently on the syringe and remove any bubbles. Push slowly on the plunger until the air is removed. Now, follow your orders about how to inject your medication. Section 7. Drawing medications from an ampule. We will talk about what happens if you use an ampule. Attach the filter needle onto the empty syringe. Twist clockwise to hold it in place. Take the cover off. Be very careful to not touch the needle or syringe tip. If you do, or if it touches a surface, throw the syringe away and use a new one. First, tap the top. This will help the medication in the top of the ampule settle down to the bottom of the ampule. Scrub the top of the ampule with the alcohol pad for 15 seconds. Wrap a new alcohol pad around the top of the ampule. Snap off the top of the ampule with your finger and thumb. Be careful as this is glass. Snap it away from you, then throw the top away in the sharps container. Wash your hands as you did before. Place the ampule upright on your clean surface. Unwrap the filter needle. Carefully remove the cover of the filter needle. Insert the filter needle into the opening of the ampule. Draw back the amount of ordered medication using the plunger. Remove the syringe from the ampule. Now you need to remove air from the syringe. Hold the syringe with the needle pointing straight up. Tap gently on the syringe. Push slowly on the plunger until the bubbles at the top are removed. Carefully put the clear cover back on your filter needle using the scoop technique. The clear cover should be down on the SAS or sash mat. Use the tip of the needle to scoop up the cover. Once you've scooped up the cover, push the cover fully onto the needle. Twist counterclockwise to remove the filter needle from the syringe and throw this away in the sharps container. Place a new non-filter needle on the end of the syringe. Turn clockwise. Remove the cover. Follow your orders about how to inject your medication. Wash your hands one final time as you did before. You have now completed the process of drawing up medications from vial or ampule. If you have any questions, please contact your home health nurse.